Hello, Cirilla. My name's Amber. Today I'm going to be your health educator.
Hello, nice
Well,
to meet you.
How are you doing today?
I'm doing okay. How are you?
I'm doing good. Thank you so much for asking. So I understand today that you're here to go over your pregnancy test and the results. But before we begin, I just wanted to give you a little confidentiality statement. So I just want to let you know that anything we discuss will be kept completely confidential unless that you inform me that someone is hurting you. You plan on hurting someone or you plan on hurting yourself. And in that case, I will need to share that with somebody to get you help and support that you all will need that. Is that okay?
Yeah, it's good.
Cool. Now, Sarla, going over your results, you are pregnant and the test results are positive. So, how does that make you feel?
I mean, I knew that it could be a possibility, but it still makes me feel a little bit more stressed and more anxious now that I have that confirmed.
No, definitely. Stress is a really common emotion to feel. That and a combination of a lot of other things, like it can be unexpected. Is this pregnancy something that you had planned at all?
No, just kind of random for me.
Okay, yeah, that's completely okay. That a lot of people end up finding that they are pregnant when they don't plan so, but regardless, we'll let you know all the options you have today. Do you have any family support or support of a partner during all of this?
I mean, I'm not the closest with my family, but I think that, like, if I really, really needed them, they would be there, but I think maybe a friend might be better, or, yeah.
Okay. And, other than friend and family, like, I'm really glad to hear that you could reach out to them and have that support. If you don't mind me asking, is the partner in the picture, and how do you think they'll react to finding out about the pregnancy?
The partner is in the picture. I think that they'll support me in any decisions that I make, but they'll probably be a little stressed out too.
Okay, that's completely normal. I'm glad to hear that they won't be upset or anything, and that you'll have you might have that support as well. Okay, so I know that the pregnancy was not something you had planned, but I am curious if you do know of any of your options that you have available.
Not really. I mean, I'd like if you could just remind me of what there is.
Of course. Before we get into your options and I can start explaining what you have available to you, I do want to talk about figuring out about your how many weeks you are far along. So, do you know the date of your last menstrual period?
I think it was around 7 weeks ago.
Okay, yeah, I can double check that right now in your file. Yeah, so it does seem that you are about 7 weeks pregnant, which means that you do have available all three of the options, which would be parenting, going through with the pregnancy, abortion, and as well as adoption. Those are your three options. Are you comfortable hearing about all three, or would you like await certain ones?
I could hear about all three.
Perfect. So before I get started, how are you? Just a little check-in. How are you feeling so far?
A little nervous, but I like that there's some options.
No, definitely. We will go over all the options to help ease some of those nerves, hopefully. Do you have a preference in which one you would like to talk about first?
I guess parenting.
Okay, cool. So with parenting, have you ever had a child in the past?
No.
Okay, so this would be your first child if you went through with that. How would you feel about parenting and being a parent?
I think I would be most worried about finances. I think that's what my partner would be worried about as well. But yeah, I just don't really think I'm the most ready for parenting.
Okay. Yeah, that's completely understandable to feel that way. I do want you to know that we can connect you with the proper resources that could help you financially. There are things like WIC and stuff and for like childcare expenses. So if parenting is an option that you want to go through with, we will be able to provide some of those financial resources for you.
Okay.
So yeah, so we do want you to know that if you do end up going through that option, we do have the proper resources to help connect you and help you feel a little more confident in that choice. I understand that there are some stressors that you feel about continuing the pregnancy, but we do have the resources as well. I do want to let you know that if parenting is the option that you choose, or even if you are unsure about it, we would like to get you on prenatals. So getting you on prenatals care as soon as possible would be very important, regardless of the choice you end up making, just to be provide you a little safety net if you do want to end up going through with the pregnancy.
Okay.
And we would provide you some of those resources at the end of the session as well if you're interested. Okay, now that I gave you a little bit about parenting, how do you feel about that option?
I feel a little bit relieved to know that there's some help, like with WIC and stuff, at least financially. I do feel nervous about getting on prenatal stuff because I think it all just feels so fast. I just didn't expect for this to happen.
Yeah, definitely. And I don't want to make you feel rushed at all. We just want to provide the safety for you and the baby if you end up keeping it, and if not, just making sure that you're all right. In terms of the fear of prenatal, that's completely normal. We can provide you more information to just provide you a little more clarity about that. It would just be ultimately more nourishment for you and the baby, but that's something we can talk about later along the line when you're ready to make that decision.
Okay.
Of course. Now, would you like to go over your next two options, which are abortion and adoption?
Yes, please.
Do you have a preference of which next?
I guess adoption, since we're talking about keeping the baby so far.
Of course. So, adoption, there are two options. Are you familiar with these options?
No.
Okay. So in terms of these options, since you don't know much about it, do you know how you feel about adoption at all?
I would just feel nervous to be keeping the baby and then kind of giving it up after all that time. But yeah, or just being nervous about the child maybe, like where they'll end up.
Yeah, being curious and like a little more hesitant knowing about where your baby's going, or then that is completely normal to feel. A lot of people don't tend to know much about their options. It was a lot more popular for closed adoptions, and I'll explain that a little more. So closed adoptions are confidential, meaning that the birth parent does not have any connection to the adoptive parents and the child. So the child would be placed with the adoptive parents, and completely confidential. You wouldn't know who the baby would be going with, and the baby wouldn't know who their birth parent is as well. Yeah. So that's closed adoption. The other option would be open adoption.
Okay.
So open adoption is where you would be able to have that stream of a connection, possibly between the birth parents and the adoptive family and the child. The birth parent would be allowed to have full choice in where the baby goes, who their adoptive family is, and then the families would mutually agree on what's best for the child and establishing what kind of connection they would like.
Okay.
Yeah, so that option would provide you a little more of like where the child would be going and like what family they would be placed in and what family you'd like to place them in.
Okay.
Yeah, definitely. So that's just a little about those two options. How do you feel about that, knowing a little more?
I like knowing that there's still like the open option, at least to stay updated on where the baby might be or who they go to, because I don't want to just toss them aside or anything, and not to say that closed adoptions are, but
yeah,
I guess I'd like to know myself.
Of course, we don't want you to feel that having your child up for adoption would make you feel like in any way that you're tossing your baby aside, because that's definitely not the case. It's just a matter of finding your child the perfect home. But do you have any other questions about adoption?
No, not right now.
Okay, cool. If you have any questions, just let me know. And I will let you know what it is. Okay, so the last option would be abortion. Would you like to know more about that?
Yes, please.
Okay. Do you know anything about abortion, or how do you feel about it at all?
I think I just might be leaning more towards that. I'm nervous, but I think just financially I'm not ready, emotionally I'm not ready. I don't think my partner's ready. I also just don't have the best support system to bring a baby right now. So I would like to hear more about it.
Definitely, I can understand that. Since you are leaning more towards abortion, we can give you more resources on that as well, but continuing just to give you resources on anything, because whatever choice you make is ultimately up to you. So what do you know about abortions at all? Because
I think I just know so far that you could maybe get it done at the clinic. I know there might be other options, but I'm not sure. And I know that overall it just kind of gets rid of the pregnancy. But yeah, I don't know if it like makes it harder to get pregnant in the future as well. If I ever were to choose to have a baby later on. But yeah, that's all I really know.
Yeah, so I see that you know a little, but also have some misconceptions about abortion, and that's completely normal. There's a lot of discussions around it and different opinions around it, so we're just here to provide you most of the facts around abortion. So, there are two types of abortion, and you were correct. There is a clinic form of abortion, and there's also an at-home form.
Okay.
Yeah. So, but just to let you know that abortion will not affect any pregnancy in your future. It's actually a lot safer than having a live birth.
Oh.
Yeah. So this is completely safe. You do have two options, like I said. Let's just go. Would you prefer knowing about the clinic option first or about the at-home option?
I think a clinic first.
Of course. So with the clinic, it would take a few hours just because you would be going through like lab work, they'd be checking in on you, your vitals, but the actual procedure only takes about a few minutes.
Oh, okay.
Yeah, so with the procedure, I'll just show you this little diagram. So a little tube's going to be entering your uterus, and that's where you'll feel a little pain and cramping, and that's where just they'll suck out the embryo and the fetus. And then they'll remove it, and so the only pain you'll feel is cramping, but that cramping will vary from patient to patient.
Okay.
And yeah, the procedure will only be a few minutes, and then the rest of it will have to just be in the clinic waiting. You might also have to do a little counseling as well, just to make sure that you're okay with everything that's happening in the process of it. Yeah. So that one is called an aspiration abortion, where the other one would be called a medication abortion.
Okay.
So the medication abortion is where it would be taken at home. It would be anywhere from a few days to a few weeks, and that's only because you take 2 pills.
Okay.
One pill is what would end the pregnancy, and then the second pill you would take after a day.
Okay.
And that is when you would, essentially the pill would force out the pregnancy, and you would have some cramping and bleeding for the next few days to weeks, just depending on when and how your body processes it.
Okay.
But yeah, so some people tend to do the option just because it's in the own privacy of their home. How do you feel about those two options? Do you have any other questions?
If I were to do the one in the clinic, would I be able to drive myself home, or do I have to bring someone in, like a surgery kind of?
Okay. That honestly really depends on you and how you're reacting. I would recommend that you possibly have someone, but since I know that your support system is a little iffy, you're not really sure where you stand with them, you would be able to, but the clinic might just have you stay a little longer to make sure that you're okay.
Okay.
I also remember that you mentioned that you're a little concerned about financials.
Yeah.
Yeah, so I'm not sure about your insurance. We can definitely check the resources later, but for the most part, we do know that there are abortion options that are free for Medi-Cal, as well as like small payments, just because depending on the state that you're in, we will find the proper resources and connections for you, so you don't have to financially worry about that as well.
Okay.
Yeah, how do you feel about all of that?
I think the financial part also sounds relieving as well. I think I could maybe lean towards that and maybe talk to my partner if they'd like to come and support me at the clinic. But yeah, I just think the clinic process sounds a lot faster than doing it at home. I think I don't want to really drag it out and kind of just make my choice as soon as possible.
Yeah, whatever works for you is going to be the best for you. Like, you will know what's best for you, and we'll help give you the resources to get you there. Okay, but yeah, so those are your 3 options. How are you feeling now about this pregnancy? Like, now that you know a little more about it.
I guess I feel a little bit better. I feel more supported, at least, just with you talking to me about everything, and also just not being judgmental with this sort of stuff, because I feel like it kind of just springs on you, and I don't really know what to do or what my options are, and it's just nice to be learning what there is, and also financially what there could be with both decisions, whether I keep it or not. So I just really appreciate your help today.
No, definitely. I'm so glad to hear that. I really understand that this
Mhm.
is it's really difficult to navigate.
Yeah.
And it's just like, I'm really glad that I can be here to help navigate and give you the proper resources and like just the information that you need to help better you through this decision.
Yeah.
I just want you to know that you do still have some time to decide. So I don't want you to feel pressured about making any decision. You don't have to make a decision today about what you want to do. Again, take your time. Do you feel like you have the proper support to talk about this and talk through your options with someone else?
Yeah, I think I could definitely just reach out to a friend or my partner at least. So I have those two people.
Okay, I'm glad that you have someone. Definitely, if you have any other questions or just want to talk to a counselor again, definitely reach out.
Okay.
I do want to provide some resources and referrals to you now if you're comfortable with them.
Okay, no problem.
Would you like resources and referrals on all three options, or do you have a preference of what you'd like to leave today with?
I think I could do on all three options.
Of course, cool. So yeah, so I'll just give you options. It'll be local and a few non-local referrals. I just want you to know that whenever you're ready, I can help you set up these appointments, as well as help getting that conversation started with you to other clinics with either prenatals, with abortions, with adoption agencies, whatever choice you end up deciding and I can help be there with you or help connect you with the right people that can help you with that. Yeah, how are you feeling now?
Just a little more relieved and supported, so thank you.
I'm glad. And remember, whatever you end up deciding is your own decision, and I hope that you can feel confident and comfortable with that.
Thank you.
Thank you for coming in today. And then here's some of the resources, and I'll get the rest for you right now.
Thank you.